Welcome to today's CMM webinar brought to you by our sponsors, Annihilator, Ecolab, iOffice, and Space IQ, and SteraMist by Tomy Environmental Solutions. I'm CMM Managing Editor, Amy Richardson, and I'll be moderating today's presentation. Thank you for joining us. CMM offers many resources for facility managers, in-house service providers, and building service contractors. Visit cmmonline.com to subscribe to our magazine and sign up for our daily news, and be sure to connect with us on social media. Here are a few things to keep in mind before we get started. Use the Q&A portal to submit questions during today's program. Our speakers will answer as many as possible at the end of the hour. Today's webinar will be recorded, and you will receive an email with the recording later this week. It will also be posted on our website. Before we begin, let's hear from our sponsor, SteraMist by Tomy Environmental Solutions. Now, I'd like to introduce today's speakers. Dr. Paul Meechan has nearly 30 years of experience in biosafety and currently serves on the board of the Global Biorisk Advisory Council, a division of ISSA. A veteran of the pharmaceutical industry, Meechan has also worked for the U.S. Centers for Disease Control and Prevention. As president and CEO of Cervicon, Lori Sewell steers the growth and strategic direction of this woman-owned and operated facilities maintenance company, which specializes in complex facilities in the healthcare, aerospace, and life sciences industries. As CEO of Elite Facility Systems, Tricia Holderman creates environments that allow people to work, meet, and live free from an overwhelming fear of germs. A 43-year veteran of the cleaning services industry, she has written Germinator, the Germ Girl's Guide to Simple Solutions in a Germ-Filled World. Thank you for joining us today. Let's get started with you, Paul.
Thanks, Amy. And hello to everyone. I'm glad that you're able to join us. I've been given the honor to start the discussion, and with my background is more in the research community, I'll be talking more about it in terms of the theoretical and the regulatory side. And my colleagues, Lori and Tricia, will be talking about it from the practical experience point of view. So I want to be able to do this in terms of a case study. And so let me set up a scenario for you. In this case, consider yourself a person responsible for the cleaning of a convention center. Well, there's been a children's organization that's been meeting, and they have been bringing their children with them. And so there are multiple children there that are under the age of 5. And as usual, when you're dealing with small children, a number of them will have runny noses, and they're wiping their noses with their hands, as you've seen small children do. And then touch everything with those hands. Escalator sides, railings, wood furniture, granite countertops, marble mounted countertops, aluminum panels that you've got, decorative panels everywhere. So what are the key things that you need to be thinking about when trying to deal with that situation? Next slide, please. So we've got the key questions. So what are you trying to kill? For the past 2 years, we've really been focused on SARS-CoV-2, the causative agent of COVID. And that's for good cause. One is the pandemic. But the second thing is that over the past year, the normal seasonal viruses, respiratory viruses that are common in this country, influenza, respiratory syncytial virus, rhinovirus, other coronaviruses, have all been suppressed. whether that's due to the pandemic or due to the response by the members of the public and the cleaning community for doing a great job in cleaning and disinfecting, we basically wiped out flu cases last year. But as we move back to the normal, we've seen a recurrence of those respiratory diseases. And so now we have to be thinking beyond COVID. What are we actually trying to kill? Second question is, where is it? Where are you finding it? Where is the risk? The one thing we want to avoid, as always, is the sort of hygiene theater. And you could see it at the Olympics. You could see that the organizing committee and the associated facilities were being sprayed with disinfectant out in parking lots and grass areas and sidewalks. Ineffective and spreading disinfectants that are designed to kill organisms. Now, the volumes and concentrations we generally use, that's not particularly hazardous to us, but as my colleagues will point out, some of them do have significant health issues in the concentrated form. And so that ought to be taken into account to minimize where they're not useful. And finally, what is it that you can use to actually clean and disinfect? And notice I've added both of those terms in there because they're not synonymous, and most of you already know that. But it is important to remember that cleaning is not necessarily disinfecting, and a disinfectant may not clean. And if you do it wrong, you haven't done it at all. Next slide, please. So let's think about what you're trying to kill. As I said, the past 2 years, we've really been focused on COVID, on SARS-CoV-2, SARS-CoV-2. SARS-CoV-2 is actually pretty easy to kill. It is what's known as an envelope virus. It has a membrane around it. Think about it as though it's got fat or oil around it, which is what basically a membrane contains as its major constituents. And so anything that disrupts it or solubilizes that can inactivate the virus. And if you start talking to scientists, they'll use the term inactivate rather than kill, because technically viruses aren't alive. And so there's always that, well, they're not actually killing it. Functionally, they're the same thing. They're not going to reproduce. But now that we're back to a more normal situation, we are still concerned about COVID. It's not gone away. And we don't know what's going to happen next. We don't know what the son of Omicron is going to look like. We hope, but we don't know. But other respiratory diseases are coming back. Like I said, influenza is coming back, respiratory syncytial virus, significant disease in small children. Other common cold viruses, like a rhinovirus, are coming back as well. And rhinoviruses and viruses like them are different from a non-envelope virus, or from an envelope virus, my apologies. It's non-enveloped. It doesn't have that lipid shell around it that's easy to kill. Those are protein shells, and they're much more difficult to inactivate. And so as you can see over on the right, there's a list of different agents that one might find in the environment, and that you go from most resistant to disinfection down to the bottom. And the ones at the bottom are those envelope viruses like SARS-CoV-2 or influenza. But if you look in the middle, under non-lipid or small viruses, something like a rhinovirus, fairly common cold virus, is somewhere in the middle, and it will take a more potent disinfectant to be able to actually inactivate it. Next slide, please. So how do you know which one to choose? Well, we're slightly lucky, at least in the States and in most other developed countries, in that a disinfectant needs to be registered with, in the United States case, the Environmental Protection Agency, under the Federal Insecticide, Fungicide, and Rodenticide Act, FIFRA. The label on them has to have specific claims that are proven to be able to inactivate various agents, viruses, bacteria, fungi, etc. So how do you pick one? Well, for most of the past couple of years, we've all been looking at SARS-CoV-2, and the EPA has taken all the disinfectants that have those claims against SARS-CoV-2, and they put them into a list. In this case, it is called the EPA List N, and you've probably already heard this. But if there's List N, there's other lists before. There's A through, in this case now, P. And so you can go to a different list for the material that you're looking to inactivate. For a non-envelope virus, there's another one that would probably be fairly appropriate to be looking at. And this has been done, it was done during SARS-CoV-2 because initially there were no claims for it. So the CDC recommended that you use a disinfectant that was listed for something that would inactivate fungi and non-envelope viruses. Well, it happens to be norovirus is a non-envelope virus. So in the absence of specific label claims that allow you to say, oh, we're actually inactivating rhinovirus, you can look for one that has a non-envelope virus claim, or one like in list G that is effective against norovirus because it is a non-envelope virus. Now, when you get that information, you still have to take a look at the label to make sure that you understand the specific label claims as well as the contact time. Because if you don't do something long enough, it's ineffective. Have the next slide, please. There's a huge difference between cleaning and disinfecting. Now, there are chemicals, compounds in those lists that are what are known as one-step disinfectants. But the issue is always fairly simple, and that is that in order for a disinfectant to work, it actually has to come in contact with the agent you want to kill, the pathogen. In this case, maybe it's rhinovirus. So if it's from some child who has wiped their nose and wiped it on a surface, it has to get through that mucus. And it's not a fairly simple process. It's got a lot of protein. It's got a lot of complex carbohydrates. You have to dissolve that, and then the disinfectant has to work. And so the amount of time necessary to make that happen can be quite significant. So I took a look inside list N for the norovirus, and I pulled up a compound, and this happened to be a quaternary ammonium complex, and my colleague Lori will be talking about that, and looked at its contact time for rhinovirus, which is a non-envelope virus. It required it to be in contact, wet, for 10 minutes to do its job. You can probably find cleaners that clean the surface, remove the mucus much faster, and then there's a whole number of disinfectants that work much faster against non-envelope viruses. And so you can do a one-step process, but the probability that you will have adequate contact time is a decision you have to make. And in most cases, especially if you're working on a vertical surface, may be nearly impossible to do. Next slide, please. Last thing to consider is you have to actually consider the surface. Is it compatible with the chemical you're working with? So the photo you've got there is actually from the Washington, D.C. Metro, where they have extraordinarily long escalators that are all stainless steel panels. And you're dealing with small children, they're holding onto the panels. They're not able to get onto the railings. And so you'll have that entire panel streaked. So if you were to clean or try to disinfect that, what are you going to use? You want to use bleach? Well, it's fairly cheap, but it's also a terrible cleaner. And also, it's fairly aggressive, and you will destroy those steel panels. So on 2 counts, it's a bad choice. So what if you were taking a different surface? You had raw wood, you had marble, you had something that was porous. You have the potential for absorption of your disinfectant? And the answer is yes, you do. And that poses a significantly different problem for you. So should you be considering an alcohol-based disinfectant? Depends on the organism you're trying to kill. In many cases, you'll find that for a non-envelope virus, an alcohol-based compound will not be sufficient. And so balancing the need for disinfection against the materials that you're working with is a significant concern. And Lori will actually go into a little bit more detail about it. She has a great chart that you'll be able to take a look at in her talk, which is coming up after a short commercial break. So thank you for your time.
Thank you, Paul. Yes, before we turn the program over to Lori, let's hear from our sponsor, Annihilator.
With the combined surge of transmissible diseases like COVID-19, drug-resistant superbugs, and various other healthcare-acquired infections, it makes sense to see a drastic increase in cleaning and disinfecting frequencies throughout healthcare facilities. As a result of this increase, however, patients and personnel are being exposed to large amounts of toxic chemicals that lead to chemical burns, respiratory, reproductive, and nervous system issues. This creates a slippery slope in the overall big picture of health and safety. So, What if there was a way to successfully destroy these pathogens, eliminate toxic chemical exposure, and digitally monitor effective protocols using an integrated system and technology? At Annihilator, we can help. To learn more, visit annihilator.com.
Okay, don't forget you can submit questions through the Q&A portal during the presentation. And now let's turn it over to Lori Sewell of Cervicon. Thanks, Lori.
Hi, thank you. It's great to be with you today. So back in March of 2020, when the World Health Organization declared a pandemic, a client of ours called my colleague and asked him if he could come in and talk to him about keeping his facility safe during the pandemic. It was not a healthcare facility. It was manufacturing office space, quite a large facility, and it was an essential industry. So his employees had to remain on the job working in the facility during the pandemic. So he also had some COVID positives. And he asked my colleague how he could maintain the facility. So my colleague started to share with him the fact that we do work in healthcare facilities. And in healthcare facilities, when there's an infectious disease, we do something called terminal cleaning. So we discussed how he was going to translate that terminal cleaning work into his facility to ensure that it was free of infection. And the client goes, no. We're not a hospital here. We're not healthcare. We don't need that. And my colleague said to him, well, when COVID comes to the door, comes into your facility, it doesn't know that you're a healthcare facility or not, or an office space. It's going to act the same way. And we're going to have to treat it the same way, which is when there was a big aha moment for him. And he was like, oh, I understand. You have to do that in my environment. So next slide, please. So since infection prevention isn't just for healthcare anymore, here are some key elements to a good prevention program for all environments. Next slide. So you heard Paul talking about choosing the right chemistry. So the common types of disinfecting chemistries used in our industry today are hypochlorous acid, hydrogen peroxide, and quaternary ammonium, or we refer to them as quats. And then, of course, there's bleach. Each of these chemistries have numerous options that are approved as infected and killing SARS-CoV-2, and then all of the other viruses that you had seen earlier on different lists that Paul had noted. But in order to determine which one is best for your use, you need to consider the following. Next slide, please. So the chemistry you choose really depended upon a number of factors. So you heard Paul talk a little bit about what surfaces are going to put them on, what type of viruses you're trying to kill. So if you think about this is kind of a rubric for deciding what chemistry you would use in the facility that you clean. So first you have to think about what type of environment are you cleaning? Is it a healthcare facility, a school, an office? What types of pathogens are present there? And you really, again, want to match your disinfectants kill claim with the type of pathogens in that environment. That's key. Then you consider the occupants in those spaces. Are they a vulnerable population? Do they use a lot of shared and common spaces? Are they present while you're disinfecting? Because this will also influence your decision. Then identifying the surface types that you're cleaning and how to disinfect them. Some disinfectants, remember, can be very harsh and damaging to certain surfaces. You then want to evaluate how safe is the product for the users and the people in the facility. What's the level of PPE that's required for the people that are applying them for your team? You want to also consider the long-term effects of the chemistry and the application method to the natural environment, the sustainability impact, if you will. Finally, you want to think about which products that are efficient in terms of your labor, not just the cost per gallon. You actually want to calculate, you heard Paul talk about dwell times. You want to calculate how long the disinfection process takes from dilution to application to dwell time and then removal. And so once you determine the right chemistry for your clients, I want you to imagine taking a checklist with some of these questions into your client and showing them how you've designed a unique program specific to meet their needs. Can you see how this would maybe change the conversation around your services? It could differentiate you from your competition. So let me share just a really brief example on how we use this criteria to choose our chemistries. Next slide, please. We worked with an epidemiologist and we performed some microswabbing tests on quat-based hydrogen peroxide and hypochlorous acid, which is shown as NADCC on this chart here, and disinfectants. So we use these results and the selection criteria that I mentioned before to select our chemistries. So in brief, here's the decisions that we made. The quat killed varied and numerous pathogens, but it does not kill C. diff or Candida auris, which is present in our healthcare environment. So right there, you know that we can't use that in our healthcare environments. We also know that quats have been around a long time. They're very affordable. However, they bind with microfiber towels, which makes them less effective with laundered microfibers. They can also damage surfaces and leave sticky residue. And there are also concerns about the healthfulness to the user and building occupants with prolonged use. So where would we continue to use quats? Well, definitely not in healthcare settings, and possibly in a building where occupants are not present when disinfecting is being done, and maybe when it's a small part of the custodial technician's responsibility, potentially on floors. So the ready-to-use hydrogen peroxide had a similar kill to this kill spectrum. When I say spectrum, I mean wide variant types of pathogens as quats. They don't have the microfiber binding issue that the quats have. They are safer to use. They do typically cost more per unit. In ours in particular, this hydrogen peroxide was ready to use. However, because they don't often require rinsing, you can pick up labor efficiencies, which lowers the cost in use. So where we would use this chemistry is in our non-healthcare facilities to replace the use of quats for disinfecting. And then finally, we tested hypochlorous acid in a tablet form. It is an extremely broad spectrum disinfectant, kills C. diff and Candida auris. Unfortunately, the dilution and soaking process took about 12 minutes, so it's a little more time consuming than ready-to-use product. But when it is diluted, it has a neutral pH, makes it safe on surfaces, safe for users, safe for occupants. Unfortunately, a slight downside is that the shelf life of the product is 24 to 72 hours, so you need to use it quickly. So we will be using this chemistry in our healthcare and other critical environments. And today, hypochlorous acid is kind of the biggest contender to replace bleach in the healthcare facilities today. Next slide. So another key element to your infection prevention program is your technology and your innovation. You probably remember a lot of companies popping up during COVID cleaning who weren't even in the cleaning industry, using misters, foggers, and paint sprayers to apply disinfectant. So the first most important thing to know that in order for your product, for the disinfectant to be effective, as approved by the EPA, they must be used in accordance with the manufacturer's labeling. So when people were putting these different types of technologies through these other application methods that wasn't on the labeling, there was no guarantee that they were killing the pathogens as labeled. So for broad application in large areas, we like to use electrostatic sprayers with hypochlorous acid tablets. We also like electrostatic because it wraps around surfaces. However, there are many companies introducing new disinfecting technologies right now, and we all need to stay abreast of those. And we're super excited about researching and looking into those new options. So I think the big takeaways here are: one, be careful to match your chemistry with the labeled application method, and two, continue to research and be open to implementing new technologies. Next slide. So while chemistries and technology is important, they are not effective unless you put them into the hands of a trained workforce. We have to invest our time in not just training our people on SOPs, but the why of the procedures. Just giving them a list of steps and how to do it doesn't allow them to really connect with the importance of the work. They need to understand that, for example, why do we have dwell time, like Paul had said earlier? This allows for a professional level of understanding, and it ensures that they perform their work effectively. You want to also continue to communicate to your teams about changes in regulations, processes, and products so that they feel safe and confident. Remember, proper training really ensures that you have effective and quality work, that your team is safe, that the occupants of the facilities are safe. And there's an increased sense of personal value and importance when they understand that. And then also an increased value of your work is perceived by your client. Next slide. The next step in a good infection prevention program is validation. At the very basic level, we've all been validating our work for years. Does it look clean? Can you see visible dirt? However, cleaning for visibility doesn't work anymore, and it doesn't validate that you've disinfected properly. So we need to go deeper. So using methods like ATP, while not perfect, and really only measures the effect of cleaning but not disinfecting, it's really a good start. Microbial swabbing is that next level of validation that determines if you properly disinfected and what pathogens remain on the surface. Historically, those methods have been very time-consuming and expensive. However, there are some new technologies being deployed today that can provide valid in-field results within 60 to 90 minutes. So we're super excited about testing these and putting these into use. And then you've got that final third-party validation that takes it to another level, like the study we did working with an organization like TIPS, the Infection Prevention Specialists, and GBAC, or other expert consulting groups to find that additional stamp of approval. Next slide. And the final key to your infection program is marketing. First of all, share your documentation of your process and your training materials with your clients. It's going to build the confidence in your work with them. Get that certification, that stamp of approval, put it on your marketing, your training materials, your website, your social media. Then educate your customer, not just on infection prevention, but on CDC guidelines with other pandemic-related information, or such as state regulations regarding sick leave, masking requirements, other policies that affect our workforce. Other things that the CDC shares beyond COVID, in addition to other types of viruses like Paul was referring to. These actions will not only build the confidence in your program, it's going to separate you from those low-cost competitors who I like to say use the spray and pray method. And most importantly, it will allow you to increase the value of your work and ultimately the price you can command. So another key ingredient is visibility. People want to see high touch point disinfecting teams in their place. They want to see people doing the cleaning and the disinfecting. It makes them feel safer. So we had clients that wanted us to put, when we were doing the high touch point disinfection, put them in different vests or different uniforms so their employees could see what they were doing. Some people are referring to their day porters now as health porters. You can utilize logs showing the last time an area was cleaned or disinfected. We use an app that provides real-time information to clients and occupants about areas that have been cleaned and disinfected. But most importantly, you want to continue to stay abreast of all the new technologies and evolve your program. Share that evolution with your customers and prospects, be email campaigns, client business reviews, or even if you're just in a conversation with them. So you want to be the trusted resource regarding infection prevention for your client. So when you do this, it not only elevates the value of your services in your client's eyes, but it's going to elevate our entire industry and the importance of the work that we do to keep people safe and healthy. And frankly, during COVID, keeping the engines of our economy running. Thank you.
Thanks, Laurie. We will now hear from our sponsor, iOffice and Space IQ, before we move on to our final presentation from Tricia.
A computerized maintenance management system brings all your equipment, data, and communications into one digital platform. This makes it easy to stay on top of preventive maintenance activities, inventory, and work orders. You can address small problems before they lead to equipment downtime. You can also keep track of labor costs and vendor invoices so nothing falls through the cracks.
Okay, now let's turn it over to Tricia Holderman of Elite Facility Systems. Thanks, Tricia.
You're welcome. Welcome, everybody. I want to talk a little bit about how to budget and bid on infection prevention programs. And while I will touch on a lot of the things everybody has already talked about, I'm going to talk about how to add that in to your budgeting and bidding process. So first up, there is no magic formula. I really wish that we had something that we could just plug in the numbers of the square footage, but that doesn't really work in infection prevention. As everybody has said earlier, there's too many volatile changes, differences, what kind of germs, what kind of settings, all of those are a little bit too much to just have a magic formula. So the very first thing that we are going to suggest is that you create a specialized task list. For the policy and procedures of every task list, make sure everybody understands which chemical can be used on which surfaces, how frequently it needs to be done, if you're going to use a microfiber, if you're going to use a disposable wipe, and also the frequencies of each task. We have been in several buildings lately. What we have been doing is saying, you know what, we're just going to pick up the office trash on Mondays, Wednesdays, and Fridays, so that we can concentrate on other areas that may need some time, a little more time than what we're used to. Including travel times. Now, I know all of you do travel times in all of your things, but what we have seen with with infected materials, and we do a lot of healthcare where there is soiled laundry. We actually have one facility that you have to go through a lobby with infected laundry. And so we've had to work around a different travel time, meaning we have to put that somewhere else until we can get through the actual lobby. PPE, you can imagine this is like the craziest thing right now. We have talked most of our clients into providing the gloves for us. We can obviously do our own masks and any of the other things that we need. But the reason why gloves have gotten so hard is unless you are buying an 18-wheeler truckload of these things, we're not getting the highest quality. Most of our clients are healthcare, and so we are able to get the gloves from them. They're getting really good high quality gloves, as well as getting them at a much better cost than we can at this point. The other thing that you want to figure out is if there's something you can add to that list. And while these might not really seem like infection prevention, they're still, like, as Lori said, separating you from the competition of the people who are just going in, pulling trash and vacuuming. So can you do their eye wash testing station? Most buildings have those now. We do a lot of dental offices. We do their trap cleanings. It doesn't take very long to do those. Next. Thank you. So on this task list, it's not just about what's going to be happening, but it's also about who's doing what. There have been many a times where clients think that we are supposed to be doing this, and really the conversation that you have with either the HR person or the operations person, they're not communicating it down to their staff. And the problem with that is that nobody understands that now you're only going to pick up trash once or twice a week, but the last clean company picked it up every day. They do need to be educated on what you are bringing to the table, why you're doing it the way you're doing it. And as Lori had said as well, we give our clients those tasks lists so that they understand this is really what we are doing. Next, please. So day cleaning, as Lori said, clients are really truly buying into the fact that they want to see the cleaning going on. We actually put our day porters, we don't call them porters, we actually call them technicians. We put them in lab coats because it truly does say, I'm not a janitor, I am truly different than that. What we have found too is that is helping our nighttime cost from being so big. We truly have been able to keep some of the projects being done during the day. That allows my night crew to go in, maybe in the restrooms, and just clean the floors and pick up the trash. She's also doing projects. So in most of our accounts, they're doing everything from like checking the dates on the janitorial closets, the janitorial supplies are kept in place, the inventory of those are being kept up with. The cons, smells, dwell times, and moving the dust. Specialty needs, I'm sorry, that's on that line. It shouldn't have been, it's a separate one. But we love being there for when they have a special need. And yes, that's usually about a positive case, an outbreak, but it could also be as simple as somebody vomiting somewhere that we can go and help with that process. Next. So qualifying staff, various labor costs go into this. Obviously, if we're cleaning an operating room, our staff is trained differently than the person who is just doing the lobbies in the restrooms. Cross-training staff is very important so that if somebody is absent, one of these ideas or one of these areas rather is not being missed. In your labor variable, how much certification is needed and what is the cost for that? We are currently working with a client on doing GBAC and the various things that go into that. Our staff isn't on site when they're going through that certification training part of it. You need to make sure you're building all of that into there as well. So workloading. Workloading comes, we use 4 different categories for workloading. Square footage, obviously, but it's also about the frequency that we're cleaning each specific square footage, excuse me, and then the area. So we divide area into 2 concerns. One is Is it just an operating room? We know that person is going to stay in that operating room. But we also have what's called areas of concern. So on one of our accounts, we have a young man who has autism, and his area of concern is to just go through and do all the door handles, do all the light switches, elevator buttons, escalator rails. So that is just what his workloading is about. And believe it or not, that truly helps with our higher cost staff who needs to be pulling apart maybe an operating room bed or a patient room. It helps them to get through their jobs just a little bit faster. So floaters. Our floaters are a lot like our day technicians. Floaters are in charge of doing everything and anything that is not identified by the actual work job description for the individuals that are assigned to those accounts. Excuse me. Next. Thank you. So while size does matter, we go by what is called density and usage. So obviously a wide open lobby like this isn't going to take very much time, whereas doing the lockers do. So we do a couple of professional NBA, NFL teams, making sure that their lockers are not, that is totally disinfected, but it's also about the benches, it's the showers, it's the shower handles. Everything in there has to be touched every single night. And one of our locker rooms is 24 man hours a night we spend in there cleaning that. So again, while we spend a lot of time taking care of those areas, we're going to breeze right through these little lobbies. And part of that is we'll do the disinfecting spraying, doing the high touch points. But you got to pay attention more to just density. It is no longer just about the size of these. Next. Thank you. So, go back. So after the labor variables, so we'll skip to marketing for now. We'll see if we can get back to that other one. Oh, there we go. So recommended policies and procedures. While you are usually given an RFP or RFP, was about data. We truly had a client who had mats in front of the door with bleach and water in them. So while I think that's supposed to be part of the RFB, that it's going to be our job to change those, it was my job to educate them and say, this is why this is not working. And this is where it's costing us more by doing the floor work more often, because now I have bleach on the floor, but also the mitigation of a slip or a fall hazard was not ever even thought of in this plan. And why they thought that they were going to catch a germ off the floor was like, okay, nobody's eating off the floor, nobody's dropping stuff and picking it up, it's going in the trash. Educating them on that. So on a lot of RFPs, we're not allowed to do any changes, but on most, you can make recommendations. Take the opportunity to do that. Regulatory and insurance costs. Insurances, we have found, and we work in several states, we have a few states now that are requiring us to do the CPL insurance. In CPL, contractors pollution liability, it's also called contractors environmental liability in some states. As the insurance companies are now excluding biohazards, and unfortunately so much of healthcare and Band-Aids even now are being considered hazardous material. You want to be very careful about offering that. If your client's requiring it, making sure that you have that covered and making sure you have proof of coverage on that. That does, again, it's going to be a cost that every state has been a phenomenally different cost. There is no set number for that as well. So miscellaneous costs to put in here. We saw more and more buildings going to these battery operated hand dryers, soap containers. Be very careful about that. You do not get stuck with being the batteries person. That changing the batteries, yes. The cost for those batteries, is it their responsibility or yours? I cannot tell you how many of those batteries we're going through right now. It's crazy. Quality control technologies. Laura discussed this with the ATP. There are so many different types of testing coming out that's going to allow us to get better and better about proving that we've done our job. And proving that you've done your job is very important for several reasons. A, making sure that you have the right things in place. B, making sure that your clients are safe, their facilities are safe, and that you're not ruining their facilities. We had a client who was using a disinfectant that they were using during the day hours. It turned out to be an NABC, non-acid bowl cleaner, that they had stuck in a spray bottle. Do we want to take that out of their hands? They don't need to be doing that during the day. We're going to take care of their building. So please don't do stuff. Next. Do I have? Maybe. No, there we go. So, and when you're marketing, and Lori and I are so much the same on this, when you're marketing, we actually changed our name in 2006 because we did say Elite Facility Services for a while there, but we wanted to get to the point that it wasn't just about servicing their buildings. It was about teaching them. It was about being the experts out there. And all of that evolved into now saying systems. So the company name is Systems. We moved it to that because now we're working with architects and designers, working with contractors, and doing even pre-build and design infection prevention. So while you might not be at that level just yet, maybe creating a tagline or a division that gives you that notoriety, for lack of a better word, that you are truly an infection prevention company. All of our clients right now are coming from engagement. We're not selling. We haven't paid for advertising since the 80s. We haven't had a salesperson on staff since probably the 90s. But when I say we're coming from engagement, I go to PTAs. I give speeches at PTAs, Lions, Rotaries. I do all the cute and fun stuff. I take the little ATP and check their badges or do their cell phones. They love it. And do you know, I've been doing that for over 10 years, and I can't tell you how many times during this pandemic, people are going, God, I never knew I needed a janitor or needed somebody who knew about cleaning. But I remembered that meeting from 10 years ago. And we've picked up more clients by people just remembering that we're the people who do infection prevention. I wrote the book. That book is the most simple thing you'll ever read. But honestly, it has opened up so many doors because people have so much information out on the web that they don't know who to trust anymore. Be the expert. Go out. Don't sell. Engage. Educate. Do whatever it takes. And tell stories. People love stories. I started doing infection prevention because I had Crohn's disease, went through 30, 40 surgeries. I had to learn how to keep myself safe. And so I had written all these cute little notes to hand out to other people who were going through infusions and chemo on how to keep themselves safe. Well, those little handwritten notes that I had been giving to people turned into this little book. And it truly wasn't anything more than it was a story that I could tell, and people loved the stories. So when you're also looking to get some of these accounts, we, especially in the last 2 years, but even prior to that, a lot of healthcare hospitals, bigger companies have what is called a risk mitigation recovery preparedness fund. We've been able to tap into those with quite a bit of the services that we offer. And then we truly do bill them 2 different bills. So while one is just might be for the general cleaning or what their budget has for a cleaning thing, you can still make money by moving them over to the separate account where that money can come from and you can tap into it. Mitigation for these, we've had one insurance company in one state who literally gave us a break. It was a 10% break. It's like going to driver's ed and getting that 10% break on your insurance. Insurance companies, and maybe this is something that ISSA can work on as well. We can start getting insurance companies to give us mitigation, reduced insurance premiums. Next. So the quality of the IP program should truly be evaluated regularly. Things change. Do you know, we went from seeing tons of cubicles in all these buildings to now nobody has cubicles anymore. They're all in separate offices. They're working from home. So even though 3 months ago we may have done a building this way, it's changed drastically. And achievement should be celebrated. I put this in here because that's one of the most important things we have done is sent back to our clients what we've accomplished this month. With the NBA team that we cleaned for, we went 30 days, not a single person on our team was in any of the isolation, what do you call it? It's in isolation. Long story short, we may not have had everything to do with that, but guess what? It helped. I'm just saying. Next.
Okay. That's your last slide.
Sorry, I thought there was one more for some reason. So I'm going to reiterate what Lori said, is that when you promise you're going to do infection prevention for a client, do it. Do it right. Because if you fail that client, you don't just fail that client, you do fail us as an industry. And I think more and more as our industry becomes more intelligent, more viable and essential, and helping clients stay viable and essential, we can't afford to fail them, because then we all do. So thank you for joining us today. I'll be happy to answer any questions you may have.
Thank you, Tricia. Thanks to everyone who submitted questions during the program. We've received several, so we'll go ahead and get started with the Q&A portion of the hour. So if all the speakers want to unmute, and we'll go ahead and get started. Okay, this first one might be maybe for Paul or Lori. I am going to try to say this word. Are guanides worthwhile as a disinfectant?
I'm going to give a short answer, and then I'm going to drop it over on Lori's lap. So I'll be honest, I'd be slightly concerned. Some of them have had significant anaphylactic reactions, and so I would be concerned, especially if you're talking about chlorhexidine as a disinfectant. The other thing is it does remain on the surface, and so it's not just you; it's also anyone else who may come in contact with it. I think I would treat it more as a specialty disinfectant than I would a general purpose one. Lori or Tricia, you have other thoughts?
Totally agree.
Yeah, I can only speak from my experience. We're not currently using them.
We aren't either.
Yeah.
Okay. Next question is, let's see, would you need to spray daily in schools if your facility has a needle point bipolar ionization installed in the HVAC system? And we can pass if we need to.
Well, I'm not sure. I'm curious what they mean by spray every day. I mean, are they talking about disinfecting every day? Because that might be actually helping the air quality that's coming through the vent and maybe killing anything that, or whatever it's supposed to kill, coming through the ventilation system, but the surfaces would still need disinfecting and cleaning.
Okay.
I agree.
All right. Let's see. How often should the tips be changed on dispensers in a hard water environment?
That's an
Again,
distributor
question. Yeah. But we have found some that the hard water, the calcium and lime buildup, we've been able to take some of those nozzles out and just clean them and keep using them. So I think if you're maintaining your machine well enough, that's not going to be a big issue. We had more of a hard time with the washers and things like that, if you're talking about the ISSA.
Okay. All right. Well, this one looks like it's for you, Paul. In your opinion, how well does the CDC understand the cleaning industry and what we do? Is there anything we can do to help bring us all together on the same page?
Well, okay. So first, I'm former CDC, so I do not speak for the agency. Okay. And I'm glad that's being recorded because I want that to be clear.
Noted.
Now that I'm an outsider, I will tell you, I don't think so. Most of the people that are in the agency are either healthcare professionals, or ancillary professionals, and that's the mentality they have. So I would start by going fairly simple, and there is an input for starting a discussion with CDC through what's called CDC Info, and you can actually Google it, and there's a space at which you can provide them information or submit a comment to them. Most of their information regarding cleaning is coming through the National Center for Immunization and Respiratory Diseases, NCIRD. They also have a website where you can put questions in. I think that will be less successful because CDC Info is actually part of the Office of the Director and go into the communications group. And there we can actually start making recommendations to meet with them or provide them information through institutions like ISSA, and start saying that, we as the cleaning professionals have information or can share some of our findings with you. And I think that's actually a really good idea. They need help. And I don't mean to be shortchanging CDC. Considering what they've got to work with, they're doing a pretty good job. They can always do better.
I'd like to add on to that. I just recently got invited to sit on the county board, on a committee for my county board, to make sure that there is some input for infection prevention. And I think those are good starting points, not just for the marketing side of it, but also to be a part of the community you live in, that you can bring that information to them.
Tricia, that's a great idea. And to be honest, 80% of the CDC budget goes back to state and local public health institutions. And so when you think of, somebody says, oh, CDC gets $8 billion a year. No, it doesn't. It gets it and immediately turns it back to the states. So talking to your state public health office is probably an even better idea than going to CDC. It's going to be faster and more responsive.
Okay, thank you. Next question is, Tricia, let's see, what do you think about some cleaning cloth producer statements that their cloths physically remove up to 99.99% of viruses and bacteria without using chemicals?
Yeah, no. I think in like a house, that would be possible, just because you're not as concerned about the various types of germs that might be in there. But I'm sorry, when you are in a humongous situation with lots of moving parts to it, I can't say that I buy into that just yet. I haven't seen anything that says, I haven't seen any data that helps me. You guys help me out on this one, because that one is just, it's not where I am in the work that I do. Sorry.
We can't help you out on that one because we're the same. Now, the other thing, keep in mind, Tricia, is even in a household situation, they gave it as a percentage. And so I can't think of anything that's going to pick up 99.99% of
that's a good point.
Disinfection without some sort of disinfectant or no.
Even if it does some removal, it's not killing.
Yeah.
So you need to remember that too. You might be removing some of the dirt and germs from the surface, but you're not killing or inactivating it. So I think that's something you have to consider as well.
Okay, thank you. We have a few questions on botanicals because they weren't really mentioned in the discussions earlier. Lori, did you test any botanicals like thymol or anything like that?
We did not, no.
Okay. Do any of you want to talk about the effectiveness of botanicals as disinfectants?
I have no experience with them, sorry.
And to be honest, I don't have a great deal. I have seen some studies on them where they are fairly effective. Thymol is a really good example. Part of the problem is cost. And so people that are looking for specific green chemistries, I would certainly be looking at it, but there's going to be a cost differential and it's not trivial. So I think that's one reason a lot of places aren't going there at this point.
Okay. Next question is, during which part of your program do you address the problem of removing dry biofilm from surfaces?
I think Lori touched on it, that cleaning and disinfecting aren't the same, that you do need to clean.
Yeah, I think both Lori and I mentioned that early on, that
Yeah.
it's not the same thing.
So when we were doing high touch point disinfection and we were going and cycling through those areas and disinfecting early in the pandemic, there wouldn't necessarily be a requirement to pre-clean in that circumstance because we'd just been there a few hours earlier and we're continuing to go back and forth. But we did have some sites where we went in and did COVID positive cleaning at locations where we weren't doing disinfecting and cleaning, at locations where we weren't doing the cleaning. And we were doing some spraying on walls and you have to clean first, even on the vertical surfaces. We noticed one of the guys went in and sprayed a little bit and he said just dirt was just coming down the wall. And so it's really important to remove even on those surfaces where you don't necessarily think that there's something there. It's there. You need to clean it before you can get to the disinfecting process.
This is a general question I think all of you could answer. If you could pinpoint one thing that a cleaning contractor or facility could do to improve and protect health in line with today's webinar theme, what would that be?
You know, it's interesting. I had seen that in the chat and I was thinking about it and I was like, it's a fantastic question. And I think it's educating. Really, I think it's going in and talking to the client about their scope of work and showing them that the scope of work isn't necessarily going to keep their people safe and healthy if they're doing quarterly vacuuming or quarterly this or, because we can't even, get to the germs before that. I will give you some anecdotal information. We've got clients that have scope of works that are very high-end scope of works, more daily activities, dusting, frequent vacuuming, and some that are very limited. And this is simply my experience and anecdotal, but they had more COVID positives in the areas where the frequencies were a lot less frequent and where we had reduced the scope of work. So if you want to keep people healthy all year round, no matter what's in the environment, just keeping the dust and the dirt out, you need to increase that scope of work in general and do the frequencies of the regular cleaning as well as the disinfecting in those common areas.
Good. This question, someone was just wanted a better understanding of what was discussed earlier. Are you recommending healthcare settings not use quats or hydrogen peroxide at all, except perhaps on floors?
All I can say is that's what we're doing. And usually in healthcare, in hospitals, you have to get your products approved by the infection prevention departments. So unfortunately, sadly, we still work with some clients that only will allow us to use bleach as a disinfectant. I know Trisha's like,
no, I'm having a heart attack.
But unfortunately, that's the case. And so we're in there educating and saying, no, there are better ways. There are safer products. There are other products we should be thinking about. But for now, when we're working with infection prevention departments and we ask, we're in charge of what we want to put in there. Yes, that's what we're doing. But sometimes we're asked to use other products.
Okay. Another general question on your thoughts on long-lasting antimicrobial products' effectiveness in infection prevention programs.
You want to go for that, Paul?
Well, first of all, none have been shown to be effective against viruses. So the triclosans, et cetera, that are antimicrobial surfaces are really bacterial. Or antibacterial, and they are effective. They're not quickly effective. So there's always a question of the time lag between the time that a bacterium is deposited on there and the time that it's actually inactivated. And so depending on what you're talking about, it may be just fine in a and in some places it may not be very good at all. You also get transference from that surface. So I would never have it anywhere near a food prep area, even though, let's face it, a lot of raw food is an issue, especially things like chicken for salmonella, but I would never be meeting the two of them together. Are they appropriate in some healthcare areas? I would think that might be, or schools. I think that might be an appropriate thing to be considering. But you're now talking about the cost of that versus the benefit of reducing bacterial contamination. And what we're talking about for a lot of the cleaning we've been talking about here has been for upper respiratory viruses, and they're ineffective. So it depends on the situation. Tricia or Tricia or Lori?
And I don't, this kind of goes along with, I'm saying something about the antimicrobial barriers as well. And we did do some tests in several hospitals where we did put the sealant down, like on the sinks and the countertops, and the soap turned it green. You know how soap drips every now and then? It interacted with it. And so it just looked horrible after a very, very short amount of time. And I'm talking like 7 to 10 days later, we had these big green blotches on all of our sink coverings. So I think antimicrobials at some point could be possible to be the answer to everything. It's not right now. And I don't think there's enough science that has said this is really how it works without interacting with everything else. And to that same point, we had so many of these clients who did those self-cleaning elevator buttons and stuff. It's not self-cleaning. It's like what we talked about earlier. It doesn't allow them to replicate, but it doesn't really just instantly kill them. They're not self-cleaning. They're not going to get that blood drop off by any means.
Okay. Lori, how practical is it for smaller contractors or facilities to test surfaces, such as with an ATP meter, considering the cost? Is that something feasible for smaller facilities?
I think it is. I think if you get one ATP unit, and that's what we started with. We started with one a number of years ago, and you get, you buy the swabs. Obviously, it's the cost for, buying the swabs. But you don't have to do every area you've cleaned. You only have to do a couple of areas that are representative to test and show. So I think it's if you're thinking that you're going to use it at every customer after every cleaning that you do, I think it would become, cost prohibitive for sure. But to go and show a client, even just to show them the process in an area where you've not done the cleaning and disinfection, and then and you do the pre and the post, that's a good way to show them and give them some validation of how your work has been effective.
And we've actually started doing those in our first meet and greets, doing a couple of things. Like if it's a conference table, we're doing the original, this is what we can bring to the table, showing them right then and there so that they have that concept has gone a long way to them going, okay, we buy into that, what you're talking about.
Because what it does is it gives them, we talked about that visibility versus invisible. Like you could walk in there and it looks clean. And then you're going to show them what's really there by that. So it's a great thing to show them that there's some bacteria or organizations on that table. And then you'll show that you've reduced that load after you've cleaned and disinfected. So that's really what you're showing, is that change where they can't see it visibly.
Okay. How often does your staff have negative reactions to disinfectants, or has that happened? And if it did, how did you handle it?
Wow, I don't think, so we're following all the PPE guidelines. We haven't really had that much. If somebody has had some breathing issues, we just, obviously the masks, but we really, truly, we're professionals. So we haven't gotten to that point.
Sometimes we find that people have sensitivities to certain products and chemicals, just their unique body chemistry has some or respiratory issues. And if that's the case, even when they're using the proper PPE, obviously you have them do a different type of task. So we'd remove them from that task.
And that's the same thing with gloves. We have had some people who have issues with various gloves. And so just switching the gloves for them. But accommodations are fairly easy to work around.
Okay.
And I think it's important to tell your team members that if they're sensing or having any discomfort, to let you know immediately.
Agree.
Okay. Let's see, when a company touts itself as offering an infection prevention program, are there liabilities involved? For example, if the hiring organization expects low rates of their workforce to get sick and that doesn't happen, can any of you speak to that?
There certainly is some of that. I think if you are giving them the program based on what you said that you were doing, you can't be there to watch them wash their hands every day. You can't be there to make sure they're preparing the food correctly. So I think, again, goes back to education and making sure that they understand this is what we bring to the table. But you still have some responsibilities as the company that's hiring us.
You have a lot of responsibilities. If you're not letting your people go home when they're sick or telling them to stay home when they're sick, you can clean and disinfect all you want. You will not impact their infection rate.
Okay.
One thing I would say, we operate in a number of states, but California is the state where we have most of our work. And in the state of California, it requires a pest control, or a pet license to actually use disinfectants in a larger scale. So we actually have a pest license, or pest applicators license in California. So there might be other things that you want to check in terms of legal regulations in the state that you operate to ensure that you're meeting the guidelines.
Great point. Wow.
Looks like we'll have about time for one more question and then some final thoughts. This one's about chlorine. Chlorine is still being used in cleaning. Share your thoughts on building resistance, and do you have any information on over disinfecting and how that relates to superbugs?
Chlorine is not one that comes up high on the list in terms of developing resistance. I would not have made that connection at all. Other ones, we were talking about the antimicrobial coatings like triclosan, et cetera. Those have been shown at low concentrations, essentially suboptimal concentrations, to allow for the outgrowth of antibiotic or disinfectant resistant. Not completely. They're higher. They're not immune to the disinfectants. But chlorine, Tricia or Lori, I haven't seen that.
We haven't either.
Okay. Let's see. All right. Well, I think it's about time to wrap up the presentation. Would any of you have any final thoughts or words today to share with our audience?
I think you guys asked some great questions, but I love the fact that our industry as a whole wants to keep going to those next levels, and that there's just many people interested in being better at what they do and what they offer to our clients.
Absolutely. And I loved when Tricia said get involved with local boards and things like that. We're doing presentations for just the local chamber of commerce, for small business owners. Any time you have an opportunity to share your expertise and your knowledge in the industry with your communities, it really elevates all of us.
And I think the last thing is that we can now educate our clients as to how their role is. If they simply rely on the cleaning industry to protect their people, they're not holding up their end of the bargain. It's all of us or none of us. We all have to be engaged.
Great. Thank you so much. Thanks for everyone who submitted questions. I'd like to thank today's sponsors and speakers, Paul, Lori, and Tricia. All of you will be emailed a link to the video recording of this presentation later this week. We will also post it on our website at cmmonline.com. So thanks for joining us. Have a great and safe afternoon.
Thank you.
Bye.
Bye-bye.
Bye all.